السلام
Okay.
عليكم جميعا. اليوم معنا محاضرة الأورثوبيديك سيرجري إن KSA مع الدكتورة آه، ريما. You can start, doctor.
I can start?
Yeah, sure.
Okay. So, good morning, everyone. My name is Rheema Alfadhil. I am a PGY1 orthopedic surgery resident in King Saud University Medical City. Before I start, I would like to thank the organizing committee of the Future Pathways for choosing me to give this presentation. I'm very, very honored and delighted to be presenting this and to be representing orthopedics in Saudi Arabia. And for everyone who is attending from all the different universities, I would like to thank all of you guys for attending. And starting from attending such a lecture at an early stage shows great promise. So inshallah المحاضرة تكون مفيدة for all of you. And inshallah نقابلكم وتصيروا our colleagues inshallah. So before I start, Dr. Abdul Mohsen just now, he talked about orthopedic surgery in Canada. Mashallah, he hit a lot of points, so it's going to be quite difficult to follow after that. But inshallah, we're going to be targeting different aspects in the presentation. And hopefully by the end of it, you will all benefit something through the presentation. So to start with, we're going to be covering several topics. We're going to talk about an overview on orthopedics, why people choose orthopedics, specifically why I chose orthopedics, and how can you decide if you want to choose orthopedics or not. We're going to address just very briefly about women in orthopedics and a few myths about orthopedic surgery. And then we're going to talk about the local program offered by the Saudi Council for Health Specialties. We're briefly going to talk about the daily schedule of a resident in Saudi Arabia, an orthopedic surgery resident. We're going to talk about staff positions, acceptance rate, factors that can affect your acceptance, and what resources you can read from to enhance your knowledge before starting residency, how to increase your chances of acceptance, and what are the expected tasks from trainees during an ortho rotation, whether it's an elective or an internship rotation, how to write notes in orthopedics and other tasks, and what happens if you wanted to go to or you wanted to match into orthopedics but you weren't accepted in the matching, or if you got accepted or nominated in orthopedics just not in your city of choice, and just a final few words on how to know if orthopedics is the right specialty for you. Okay. So orthopedic surgery, as Dr. Abdul Mohsen mentioned prior, it's a specialty that focuses on the diagnosis and correction and prevention of skeletal deformities. So mainly you're dealing with bones, joints, muscles, ligaments, and tendons. There are many subspecialties in orthopedics, and these were also mentioned by Dr. Abdul Mohsen. So you can either subspecialize or you can work as a general orthopedic surgeon. And that means finishing your residency and then having work experience for about 2 to 3 years after you finish your residency. So why do people choose orthopedics? And I tried as best as I can to group them into several things. At least this was how I approached it when I was planning on what to apply for when it comes to residency. So you can look at, so you can group them as patients, personal things, procedures and knowledge, innovation and research, and then collaboration, and finally challenge. So for patients, you have a lot of opportunities for both long-term care and short-term care. You can see a diverse range of patients. You're going to see peds, you're going to see young, healthy, athletic patients, you're going to see older patients with many comorbidities. And then in orthopedics itself, you're able to return both form and function to your patients. Orthopedics is the only specialty probably that puts people back on the job market. You allow people to do what they love to do, and patient outcome and satisfaction is so patient outcome is among the more favorable outcomes when it comes to which like several outcomes in different specialties. Personal things, honestly, you're able to fix a lot of the things that you encounter in practice. And like for some people, when you fix things, it keeps you motivated. It gives you instant gratification. And some people also decide, orthopedics is one of the more higher paying specialties. Or higher paying surgical specialties. And so that's why certain people target orthopedics. When it comes to procedures and knowledge, so basically for me, one of the more interesting things that I found in orthopedics is that I'm not only going to learn things about orthopedics and biomechanics and different fractures and different procedures, and also principles of surgery, but I'm also going to address physical therapy as well as radiology. Orthopedics is among the fewer specialties that don't really rely on the radiology report, and instead you get to read several imaging modalities yourself. And I personally thought that was pretty cool, and one of the things that made orthopedics unique. You have a variety of surgical procedures. You get to see arthroscopic procedures, open procedures, reconstructive procedures with, minimally invasive incisions. And that's something that's pretty interesting, and it keeps things interesting and fresh for you. There are many systems and fixation devices that you can use. Um, so it's very innovative. Even if you get to attend, say, knee replacement surgeries or knee arthroplasty several times, every procedure is going to be different depending on who you're attending with and what is the system that you're using and what type of what type of joint that you're using. And one of the things as well that you're going to see during your practice is that everything that you're going to encounter is something that you're able to feel with your hands. You're going to feel fractures with your hands when it comes to, let's say, inserting a femoral nail. You get to feel that sort of starting point with your hands. And that's something that you don't find in a lot of specialties. And it's something for people who like to feel things in order to retain knowledge or learn. That's something that really helps because you get to use several modalities of learning, such as visual or sensory and others. When it comes to collaboration, I think orthopedics is one of the not very common specialty that allows the patient himself to be actively involved in his or her own care. So when you do knee replacement surgeries, you have patients actively doing the exercises that you give them post-op or the physical therapy that you give them post-op. And that really factors into how they improve later on. It's also a collaborative work between residents and team members, and that's something that if you're someone who likes to work in a team and likes to work with people, that's something that is really nice. Orthopedics is very physically challenging, but it's also very dynamic, and that means that you're going to keep on moving, you're going to keep on doing several different procedures, and you know that no matter how many procedures you see, let's say throughout an on-call night, you're never going to be bored. And it's a busy service. It's one of the more busier services in the hospital, and that's either something that you love or something that you don't really see as something that you'd want. So just to quickly address women in orthopedics, there are only, so it's a very small percentage compared to other surgical specialties. And I think some people see it for several different reasons. I personally think it's something that you have to try yourself. You shouldn't be discouraged based on other people's opinions. If you think that you're interested and you want to give it a try it yourself, and you should build your own opinion on that. So as you can see in the picture here, I think this is one of the more commonly used jokes on orthopedic surgeons. And basically, it's whatever life-saving procedure that's there, the orthopedic surgeon will say, there's a fracture, I have to fix it. And some of the common misconceptions that you have is that a lot of people say orthopedic surgeons need to be bodybuilders, they need to be strong, and that's really all that there are for. They're just the muscle in the hospital. And honestly, it does require a lot of physical strength. It is physically demanding, but that you need to understand that if you're not doing the technique right, no matter how much force you're using, you're not, let's say, going to get that joint or that hip joint, you know, reduced. So it's more about the techniques, and there are many techniques for a lot of the fracture reductions or a lot of the joint reductions that you're going to see. And so you can try several of those and see which one works for you. Orthopedic surgery is not for women, and that's something that I hear over and over and over again. And it's unfortunate because I think there are a lot of female surgeons in orthopedics, and now that you get to see a lot more female surgeons in ortho, and even other specialties that are more quote unquote male dominant have women in them. So I think it's more so about interest and how much effort you're willing to put in. And I don't think that gender has anything to do with whatever specialty you decide to choose. The last one is orthopedic surgeons don't use their brains. They only they rely on their strength and their muscles and whatever. I think orthopedic surgery is actually one of the more complex sciences, or one of the more complex specialties, and it's not at all easy. It requires a lot of thinking when you're working. Um, and so it's not all about what you see. There's a lot of science that goes behind what you're looking at, or what procedure that you're seeing. Okay, so now we're going to jump in to talk about orthopedic surgery training in Saudi Arabia. So I can't really recall exactly how many areas there were, which are areas for training, such as Riyadh, Al-Khubar, Jeddah, Medina. But there are more than 6 areas for training by the Saudi Council. In Riyadh, there are 9 centers: مستشفى الملك خالد الجامعي، مدينة الملك فهد الطبية، مستشفى التخصصي، مستشفى الحرس، المستشفى العسكري، مستشفى الأمير محمد، مستشفى الشميسي، وقوى الأمن، ومستشفى الحبيب. And it's generally a 5-year program, so you spend 3 years as a junior and 2 years as a senior. And so orthopedic surgery in Saudi Arabia, so there are several programs all over the world that don't require annual examinations in order to pass to the next, I would say, training level. But there is an annual examination. So you have a multiple choice examination every year and an OSCE exam. And the OSCE exam is quite similar to what you see or what you do in medical school, except that it's a full-on patient approach. So history, physical examination, investigations, and then management, and just going in depth in terms of management and complications and how you can approach those. So I think you've all heard of the promotion exam or the PART exam. So that's a multiple choice examination. And then some centers may or may not have what is called the orthopedic in-training examination. And this is an annual exam that's done by the American Academy of Orthopedic Surgery. And some centers use that annual examination as part of their resident annual feedback or their level of performance, and some centers don't. In KKUH or KSUMSC or مستشفى الملك خالد الجامعي, we do take the OIT examination annually. You do have evaluations for every rotation, so you have monthly evaluations, and you get to see those evaluations every month, because if there are any comments on things that you need to improve, you can get to improve them before the end of the rotation. And research is a big part of orthopedic surgery residency in Saudi Arabia. You have to have at least 1 published orthopedic research before you finish your R4 year in order to move on to become an R5 or a PGY5. Okay, so generally orthopedics, as I mentioned earlier, is a busier service. And work hours approximately are about 50 to 60. I'm not entirely sure, but I tried to calculate how many hours it would take from, coming to work to leaving and so on and so forth with on-calls. On-calls generally depend on which center you're in, but generally on average, there are around 5 on-calls a month. And these on-calls, generally as a junior resident, you're going to have to be in-house, which means that you're going to have to physically be in the hospital. And then senior on-calls, which are for R4s and R5s, those can either be in-house or they can be from home. So, so they would only come to the hospital when needed. And this really depends on the institution as well. Your post-call schedule generally depends on the institution. So whichever institution, some institutions, they allow you to leave at 8 after you endorse and finish your morning rounds. Others would have you attend until 12. So it really depends on which institution you're in. So generally for daily resident schedule, it's quite similar to what Dr. Abdul Mehsen just now or a few hours ago he was talking about. So generally for me, so as a PGY1, I usually wake up at 5 a.m. and I would get ready and, have everything done. And then I would study for a little bit and have breakfast. And the reason is morning studying or morning reading actually helps. It's one of the time periods where you retain most knowledge. And so if I have an OR, or let's say maybe morning, so I know what the morning teaching topic is going to be about, so I would just go over quickly and read through the topic, just at least to retain a few important things. And that's something that I've started doing recently, once I started residency, and I haven't done before. And honestly, I would definitely recommend that you try it. So wake up a little bit earlier and study for a little bit before going to work or university. And then around 6, maximum by 6:30, I would be in the hospital. Because I'm the most junior resident on the team, so I'm the one who mostly covers the duties in the ward. So I would make sure I'll check on all my patients on the system. I'll ask the nurses if there were any overnight events. And then at 7 a.m., I'll go to the handover or the endorsement. And then after that, we'd have our morning teaching. So for KSUMC or Mr. Shumaik Khalid al-Jami, we have teaching about 3 to 4 times a week, morning teaching. So we finish teaching at around 8. We do our official rounds, very quick rounds, pass by all the patients who are under our service. And then at 8:30 maximum, I would be in the OR or in the clinic. And so because we have interns, we tend to utilize their presence. So I'd give them like an endorsement on the final plans. And generally, which is what I'm going to mention later on in terms of intern responsibilities, is usually writing the daily notes. And so I just tell them what the important physical findings are, what the plan is, what they need to do, if there's anything to endorse, and then we'll just divide the work between us, and I'll go to the OR or the clinic. And then at noon, around noon, I'll just check on everything, make sure that, let's say, all the consultations are done, all the orders have been placed on the system. If there are patients for discharge, I'd have all their medications ready so that they can come from the pharmacy. And then I'll continue, whether it's an OR or clinic, until around 4-ish, give or take. It really depends on how the schedule is that day. And then we do closing rounds on the system. So I'd sit with the interns, or sometimes usually we allow the interns to leave early, but in most cases I would, sit down and I would just check every single patient on the system, make sure that all their medications are ready, everything is there, their plans are very clear, and I co-sign the interns' notes. And check and make sure that they're all properly written and that all the important details are there. And because that's going to be the official documentation for these patients during that day. And then around 5:30 on most days, this is the time where I would be able to go home. But before going home, I have to check and make sure. So I have to check and examine all the post-op patients, the ones who were, let's say, if we had an OR day today, I just go there and just check and make sure everything's ready for them. And then if there are any active issues or any patients who seem to need a little bit of medical attention, maybe over the night, I'll just endorse that to the on-call 5:30, 6-ish. You know, you get home, shower, you know, sit with your family, maybe you have like a snack or something, and then I would study at around 7. So I'll rest for a little bit and then I'll start studying. Now, studying really for me, I can either do like weekly studying, which is like what I study. So every week, at the beginning of every week, I just plan out what topics I want to cover this week, depending on the rotation that I'm on. And then, and then I would also study topics on patients that I've either seen during my last on-call, or patients that I've seen in the clinic, or patients that I've seen in the OR. And how I remember those is I have like a little notebook, or at least like a piece of A4 paper that's like folded in my lab coat. And I just write anything that, like any case that I see. So let's say I saw a rotator cuff tear. And in the clinic, and so I examined, and the findings were so and so. So all I have to write in my piece of paper is to read as a title, and then I'll just write rotator cuff tear. And so when I go home that week, it's not that big of a it's not like that long of time for you to read that certain topic. And so it really helps retain when you link clinical cases to what you're reading. And that's really going to be most of what you do during your residency, specifically surgical residency, because you don't have that much time as you would in other specialties. I'd sleep around 11. I get a good 5-6 hours of sleep every day, and that's not really all that bad. So now let's talk about consultant or attending or staff member positions, because I know this is a topic, or that's really something that a lot of people ask about. Really, I can't give you a straight up answer, but from when I tried to ask or when I tried to see, it really depends on which city you're in, or which city you want to practice orthopedics in, what type of fellowship that you're choosing. There are certain fellowships that are still needed in Saudi Arabia, and then there are others that are more like, you can say, more saturated, like maybe, and it really depends on which center you want to work in. And it's really difficult to establish, because you're going to be starting as a PGY1. You need about 8 years, so you can't really estimate what happens in the next 8-10 years. But like from where I see it, is that if you're good at what you do, you're going to stand out. There are certain names when you ask about certain specialties, and these certain names tend to repeat themselves. And so because these people are really good at what they do, and they really love what they do, and then with orthopedics, honestly, people are never going to stop getting injured. People nowadays are playing sports more than they did before, because they're now more aware how sports and exercising really impacts their health. And so these patients will definitely, at some point or another, may or may not need orthopedic care. So you know that as an orthopedic surgeon, your work is never going to stop. So before I talk about the acceptance rate and how to increase your chances in acceptance, we're just going to briefly talk about the matching process. So there are things that I'm going to talk about. There are things that I'm not going to talk about. So for the matching process, generally in January, February, this is the time where the Saudi Council opens the like their website for the matching. And that's when you submit your application for points. So generally when it comes to matching, it involves 3 things. And I believe one of the doctors spoke about this before. So it will involve your CV, which is grading your CV, and that is going to be your score on the application. And then it's also going to target your GPA and your SMLE score. So for your SMLEs, you have to have them done before you start the application. And we're going to get to that later on. But when it comes to the application, they really target specific things. So they want, so these keep changing annually, but usually they're very similar to the year before. So for our year, which was not this year's matching, but the year prior, they were asking us for volunteer work. So 2 campaigns that were directed to the public population. And then Right, and then they wanted a published research. And so they have specific criteria for these things, and like they ask about like little things as such. So you should ask the year prior to you, just and try to have those things ready early on, just so that even if they change, it's not going to be that dramatic of a change. So you're still going to get to score as high as you can, because these points really count as 1 points rather than like a certain percentage, if that makes sense. And then in March, usually the nomination results are out. March through April are usually interviews, and then the final match day would be in May. So now let's talk about acceptance rate. Now I can only talk about on average and in Riyadh, because this is where I matched. So Riyadh approximately is about 34 to 36 applicants. This is at least how I remember our batch was, and around 32 get matched into centers, depending on what the available seats are that year. So they might change throughout the years. Each center approximately takes 2 to 4 residents, depending on what that center wants. And then there are centers that might take just only one. So it really, really depends on the center's requirements for that year are. So let's talk about, or the bulk of this presentation is going to be about factors that affect your acceptance, or at least in orthopedics, these are the things that really affect your acceptance. So we're going to talk about personality factors, we're going to talk about work ethic, how to prepare your CV, grades, and knowledge in orthopedics. So for personality, I don't think orthopedics is one of the specialties that really asks for much. Usually they look for applicants who are kind, who are approachable, who are team. If you don't know, ask. And if you're going to be late, inform your immediate senior or just write it on the group. Usually we have like a WhatsApp group, and just endorse your patients to your other colleagues to cover for you. It's not a problem if you're late, as long as you let people know and you endorse your patients, because this is proper patient care. Attend ORs even if you're not scrubbing in. I see a lot of interns who are interested, and then when I tell them, oh, just finish your work in the ward and come to the OR, and we don't have much in the ward, and so they wouldn't show up in the OR. And when I ask them why, they're like, well, the team's huge, like there's a big number of residents, I'm not going to be able to see anything. But this is really one of the few, like one of the little times that you're going to be able to see the entire team together. And it's one of those few times that you're going to see the attending. And how is the attending going to evaluate you if he can't see you in the OR or if he can't see you in the clinic? So there's that. And keep in mind that this is a surgical service. If you want to show that you're interested, the only place that you should be is in the OR. So wherever you go, whatever you do during your rotation, always add to the place that you're in. Even let's say you're confused between, oh, I want ortho, but I also want a different specialty, always add to the service that you're in. You want to make people miss you when you leave, because that's how you make an impression, and always make a good impression. So let's talk about preparing your CV. I understand that there was a lecture on CV. Mashallah, Dr. Mahmoud presented excellent tips in terms of CV preparation. But generally, the design should be your choice. So you should decide how you want your CV to look. And the outline, generally, personal statement or objective is really something that's controversial. Personally, when I applied for residency, I removed the objective, because sometimes it's an area that, sometimes might bring up a few things, so it's something. personal details, education qualifications, personal achievements or awards, research experience, clinical experience, presenting at conferences, courses and workshops or symposiums and conferences, management and leadership skills, and then extracurricular activities, volunteer work, references, and recommendation letters. I did not put my hobbies in my CV. It was more of a controversial thing when applying here. So I just thought it would be safer not to put that. So it really depends, but if you do decide that you want to put that, the place to be would be at the end of your CV, just before your references and recommendation letters. But to me, I didn't place that because I thought it would be more of something that you would ask your applicants rather than just have on your CV. But if you are applying abroad, they do really care about what you do in your free time. So what's really important in orthopedics, from my personal experience and from the experience of my colleagues, research was quite important. If you have any publication, even if it wasn't in orthopedics, I think it's important to show them that you have published work and that you do have experience with working on a research. Electives and rotations, that was something that was really important. Recommendation letters, and then volunteer work. So this is how I decided to. I placed it in a binder and I had it spiral bound. And so I just had my name on top, and then I just wrote orthopedic surgery residency portfolio application for the year that I was applying for. And then in the table of contents, I included my CV, and then everything else from SMLE score down to research experience were just certificates and proof of things that I've done. So whatever you put on your CV, you have to have proof of that, because it is something that they did ask us in interviews. So I thought, you know what, just make a binder, take it, like give a separate binder to every institution that you go to, and that's just it. Personally, I think the way you present your CV, if it looks nice, it's going to draw more attention to it, and if they draw more attention to it, you have a higher chance of getting accepted. It shows them that you are someone that thinks about the very intricate small details, and it shows them that you're someone who prepares beforehand, and so it really leaves a good impression. So for grades, SMLE, really it's important to get a good SMLE score. No matter how much you work on everything else, the SMLE score, unfortunately, even though it's a standardized exam, it's very important to get a good score. So focus on studying well throughout the first few months, and then trying to achieve a good score. Try to get, so when it comes to GPA, for interns, it might be, you know, khalas, they finished their years of medical school, they're only doing training. But try to improve. If you're still a medical student, try to improve or at least maintain your GPA, because that is one of the factors that may or may not play a role depending on which institution you're going. So the CV points by the Saudi Council, as I mentioned earlier, try to start on those early on. And then there are a lot of people who are asking about the grade in their orthopedic rotation during medical school. Honestly, didn't really think, no one really asked me or asked my colleagues about it, so I'm not really sure. But maybe internationally it does matter, but here in Saudi, I really didn't think it really mattered. Okay, so when it comes to knowledge, whatever you know or may not know, always be humble and know the basics. So basics basically means, yani, you would be excellent if you knew orthopedic emergencies and just proper basic orthopedic examinations. I think that's like really, really excellent. Like I said, try your best to read around your cases and patients as an intern, because you want to develop that habit early on. But again, whatever knowledge that you may have, it's not as important as being keen and eager to learn. The best compliment you can ever achieve or you can ever receive is being someone who is teachable. So always keep that in mind. So these are just a few things that you can read from for people who are interested in ortho. So orthobullets may be above your level, but it really gives a nice summarization of certain topics and certain approaches when it comes to the OR. So this is really nice to read if you don't have that much time and you want to read in between cases in the OR. Clinical orthopedic examination, and I misspelled that. This is a really, really, really good book to read when it comes to examinations. And then Netter's Orthopedic Anatomy, if you want to read about anatomy or you want to improve your anatomy, I think this is a really great book, and it's got a lot of pictures, so it's really nice for people who are visual. And then something that I experienced firsthand was publications from the AAFP, which is I think it's the Academy for Family Physicians, and they have a lot of interesting topics when it comes to the musculoskeletal section. So always check that. It gives you, let's say, the assessment of the hip in an adult, and then it just gives you at the end of every article, it has like this big table with all the differential diagnoses of hip pain in adults. And then there might be like another article which talks about how to examine the hip, and it gives you all the tests and how to do them. And so these are really nice, and they're really interesting to look at. And even as a resident, sometimes I refer to those when I feel like I'm overwhelmed and I just want to cover everything superficially and then go into depth when it comes to reading topics. Okay, so how to increase your chances of acceptance. So let's start before your rotation. You want to get a good score in your SMLE. You want to try to do research with the attendings in your center of choice. And this is more important if you're targeting an academic center or a research center. But nowadays, and even during my interviews, even centers that were not involved in research as much before are now really interested and really keen in being involved in research. And that is something that's really positive, because whatever research that you do, it's going to have it's going to be of value to whatever center that you go to. So try to do electives or internship rotations in at least 2 centers. Don't be the type of person that puts all your eggs in one place. You want to try to have several centers on hand, but don't spread yourself too thin, okay? Because you want to be remembered in several centers. So if you go to let's say 4 or 5 centers, yes, that's great, but let's say you have a lot of time and you went to a lot of centers that you took an elective maybe a year ago or 2 years ago, they might not remember unless you come back. And so you want to keep maybe 2-3 centers, I think, is really a good balance. And in that way, you can take, let's say, 2 electives in the same place. And that's going to increase your chances of being remembered. And then, so what I like to do was attend extra clinics or ORs to see cases. So I was on the OBGYN service during my internship, and there wasn't much work. So I would, inform my senior, I'd be like, listen, if you need anything, just give me a call. I'm in the hospital. I just would like to attend an extra clinic with orthopedics because I'm working on my acceptance and so on and so forth. Mostly everyone is very cooperative if you ask for permission. And so I would go and check. So if the clinics have my colleagues who are taking their elective, I would not impose, because that's not fair. This is their chance. So try to make sure that all the interns are okay with you attending. Don't impose. I tried to find clinics where no interns were attending. That's where I would sit. But I would only observe. But at least this gives you a chance to be seen by residents, to be seen by senior staff members, consultants, and that really helps them remember your face. And you get to see more cases and increase your knowledge, especially when you're free. Also, before the orthopedic rotation, what I used to do was during ER rotations, I used to do something similar. So any case that had a fracture or a dislocation, I would try to see that patient, but make sure with your colleagues before. Again, internship is a chance for everyone to learn. It's not only your experience. And this is something that you want to keep in your mind from early on. Everyone should have their chance to learn and expose, but try, if no one wants to take the case, then sure, no problem, I'll take this. And that's how you would see more cases. That's one. Two, show anyone who's in orthopedics how you give a proper consultation, and that way, you would get to see the procedure. You would have the priority to see the procedure because this is your patient. And then again, with your on-calls, if you don't have a busy on-call, you can just check who's on call for orthopedics during that day and just contact them and let them know, hey, I'm interested. If you have any cases in the ER, can you just give me a call, and I would just come and see them with you. So during your orthopedic rotation, generally we mentioned the personality and the ethics or the work ethic points that we mentioned earlier. Try to volunteer to help cover clinics once you finish your work in the ward. So when we have clinic days, usually we have a high volume of patients, and the more clinics that we can fill, the better, because we get to see patients a lot faster and we finish the clinic a lot faster. So if you finish your work in the ward, you have everything done, just endorse to the junior resident and then just ask if there's any empty clinic that they can place you in, and you can start seeing patients. This will not only improve your assessment, but it will also teach you how to see patients, how to approach patients, and how to quickly assess and examine patients. Try to read around your patients' cases, ask questions, know how to examine your patients. As I mentioned, try to read the examinations before. If you have any questions, you should definitely feel free to ask, but usually during, it's a lot better when during your internship rotation, the examinations, you're just practicing them. So you won't have that sort of transitional period once you start residency, because there's a lot you need to learn during residency. So at least having a chunk of that done beforehand not only makes you look good, but also helps you in the long term. And so I just put a little picture of what I used to do. So we used to have teaching every Wednesday when I was in the trauma rotation. And so they used to cover something called the OKU, which is the Orthopedic Knowledge Update. And so I used to read the topics and write notes as if I was a resident on the team. And trying to give yourself that full atmosphere, that full experience really helps the transition when you do start residency, because it's not that big of a shock. You've already tried your best to incorporate that type of studying and daily reading into your practice before that. Okay, so before your interview, a few weeks before, try to prepare your CV early on and try to make it as much as you can orthopedic oriented. And then, so try to prepare a document or an outline for answering common interview questions. So what I did was, so there was someone who came to us when we were interns, and he was telling us about how to go about your interviews. And so one of the things that he mentioned was there are several areas of interview questions that are usually asked. So there are questions about yourself, questions about your specialty, questions about so yourself, your specialty, and then questions about the center that you want to be in. And so try to group common questions into these groups and form them into a document, and try to practice them and see which answers really work better. And then prepare whatever items that you need before starting interviews, because you might need certain stuff tailored, you might need certain stuff done. So try to have everything ready beforehand, just so that when interview season starts, you are calm, and what you can focus on is not the materials that you need, but rather your presentation. So this is the document that I did. So it was like basically interview preparation, and then part one would be questions about myself. And then these were just a few questions that I found out from, or that I found through searching through the internet. And I just got these questions, placed them in bold, and wrote my answers down and typed them out. And then tried to see when I was answering those questions, you don't have to memorize the answers, but rather it just gives you a good outline on how you should answer those questions. And so during your interviews, try as best as you can to be punctual and a little bit early, because chances are you're going to get lost in the facility that you're going to, especially if it's a place that you've never been to before. Dress appropriately and professionally. people have different opinions on that. For my colleagues, for my male colleagues, some of them wore, you know, a thobe and just like traditional, like generally thobe and shmagh. And then for my female colleagues, some of them wore a abaya, just a basic solid, like something that looked nice, but it wasn't too flashy, and like something that wasn't too in your face. And then others wore, you know, a lab coat and like a dress shirt and pants for my male colleagues. Same thing for my female colleagues. So it really depends on what you want to wear. And it really depends on what you're comfortable wearing. It really doesn't matter that much as long as you look professional. And just have all your documents ready, be polite, and whatever question that they throw your way, always be diplomatic in your answers. And if you don't know how to answer, always try to give an introduction to your answer. Don't keep it too long, just give an introduction to your answer and then answer. Don't be extreme when it comes to your answers. So for us, when it comes to interns or students or trainees in general who come to join our ortho rotation, generally what the things that we expect from them are to do morning rounds of their patients on the system and clinically before we start our rounds. So we start our rounds in King Khalid University Hospital at around 8. So you would see your patients before, know all their labs before, know how to write a proper orthopedic assessment note, which is basically we're going to address in a few slides, follow-up arrangements and orders, conduct consultations, and then to cover clinics, ORs, and that's really plus or minus depending on the rotation that you're on and the hospital that you're in. And then presentations. Sometimes they would ask you to present a topic during your rotation. When it comes to presentations, the only tip that I can give you is do them well and really, really try, don't go into in-depth when it comes, like don't really drag yourself in all the little details, but try to keep it general, but also very cohesive, because you want to use that presentation to refer to. So for me, I had to do a presentation on supracondylar fractures in pediatrics when I was doing my pediatric ortho rotation. And so I really worked hard on that presentation, and I gathered different references and I added a few things. And then now as a resident, it's literally the reference that I used when I studied supracondylar fractures, because I addressed anatomy, I addressed treatment, and just the algorithm for like if you have a pulseless limb or so on and so forth. So it's really important that when you do something, do it, but also you want to benefit yourself in the near future. So when it comes to writing notes, these are really different from one person to the other, but generally they should be informative, concise, and clear. Whatever message that you're trying to relay should be very clear. Sometimes you can ask your senior how you want your notes to be written early on in the rotation. Shows them that you're willing to learn, and also shows them that you're willing to adapt to whatever environment you're being placed in, and that's really important. So make your own system early on in internship and try to modify it according to what your rotation you're in, and that's really the best way that you're going to make it work. So for admission notes, you have to tackle all of these. So you have to tackle chief complaint, history of present illness, review of relevant systems, hospital course if the patient was already admitted, or since admission until now, what happened, past medical, past surgical, medications, allergies, blood transfusions, family and social histories, a review of any other system that's not relevant to the complaint, and then just a physical examination, admission, labs, and investigations along with a plan. So generally when it comes to physical exam, in other specialties, you'll do a general exam, an ENT, cardiac, like all of the above. But in orthopedics, it's going to be a general exam, and then according to what's relevant. So depending on what's relevant. So for peds, you're going to examine the chest because you want to make sure that they don't have any upper respiratory tract infection or a chest infection before you take them to the OR. So it really depends on what patient you're seeing and on which service. And that's why it's important to ask before. For progress notes, the BSOAP approach is more than enough patient information, subjective, objective, and then assessment and plan. And so for subjective, it's going to be the patient's complaint along with a brief history. And then the objective will be the physical examination, labs, investigations, and then consultations can either be in the subjective or the objective. Really depends on how you want to write your note. And then just an assessment, is the patient vitally and clinically stable? What are the problem lists that the patient has in order to help you write your plan? And then when it comes to writing a plan, just this patient was seen with whom and what was the plan. So this is something that I used as an intern, and I got myself used to it early on, and I still use that when I need to. And that, first of all, makes you look very fancy, especially when you're on a surgical service, and usually surgical services don't use these. But it also really helps you when it comes to time management. So you just draw those little diagrams and just write all the relevant information or the relevant numbers that you need. So you don't really have to fill all of these out. Just write whatever is abnormal or something that needs to be reviewed, and then just what's really relevant to that patient. Okay, so for discharge summary, it's going to be, or a clinical handover note to the next service, basically admission information, hospital course, final diagnosis and significant findings, and a plan. It sounds very complex now, but once you write your first note, you're going to see, oh, I missed this, I missed that. And then little by little, you're going to improve. So that's why you should try your best to write notes really well as an intern, and that's really going to help you later on. How to present during your rounds, same format that you've written, just more concise and what's important and relevant. And then any concerns that you have, state them at the end. In orthopedics, generally, we don't do this thing where we stand at each patient's door and give a full history. No, because we already know the patients. So we just give a few important things. So subjectively, patient's having this, 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 and then objectively, she's having this, this, this. And then that's really it, and she's there's something the nurse told me that there was this, this, this overnight. And so generally we don't have this proper presentation. Sometimes when the attending is present, we do that, but it's not the usual thing that we do because we usually know these patients and we see them daily. So we already know what's going on. So consultations. Before you conduct the consultation, just know what the reason for consultation is and what the question from you. Try to know your patient as best as you can, history and physical, prior to calling that service. And then if there are certain labs, let's say for nephrology, you're calling nephrology, you need to know at least what's the patient's urea, what's the creatinine before you call them. And so if those are not there, you can just call them and say, oh, the labs are still pending, but we did order those. Is there anything else? Because you're the most junior on the team, you should be the one who knows that patient best. And so this is something that should make you more confident, not more scared or confused or nervous. And once you call those, just let your team know, I did this, 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 and just so that everyone's on the same page, everyone's aware. So this is something that maybe you guys want to take a screen capture of, and that's something that I found when I think I was in mid-internship when I found this, but it was really nice. And so before you call, and then the opening line, and then it depends on which surgery, depending on which service you're consulting, what the things that you need to cover, or at least generally know. It's not really like ABC, it's not really something that you have to do, but it's nice just to have an idea on what they might ask you. And this is really general, so it applies to most specialties. Okay, so now we're almost done. I know it's been a lot of talking and a lot to digest, but these are maybe, I don't like to be pessimistic, but sometimes I like to be someone who plans and has A, B, C, D, E. You need to know if you do everything that you can, but subhanAllah, does not happen, it does not go the way you want, it doesn't mean that you're not good enough. It does not mean anything. It's شيء مكتوب لك. And that's something that a lot of people should know. شيء مكتوب لك ما حدا غيرك حياخده. So if you do all the things above and you don't match into ortho in your city of choice, you didn't get مثلا the score that they needed or whatever, and you matched in a different city. So what do? This really is something that no one can answer for you. Even if you ask colleagues, maybe you talk to residents there, get numbers of other residents there and ask them and see things are there. But ultimately, the decision is yours. You are the one who has to decide, am I okay going 5 years away from my family, let's say? And if you have to balance leaving your loved ones in the city that, let's say, you grew up in or knew, versus doing what you love. And that really is something for you to decide. So if you decide to go, then you already need to be aware that there are applicants who have worked just as hard as worked مثلا في الرياض in, let's say, in Medina. So you need to read really well about the centers. You need to back yourself up really well and present yourself in the best way possible, because they don't know you. So you need to be stellar in order to be accepted there. And then if you decide not to go, then you can withdraw your application and reapply next year. And then we're going to talk about what things you can do before, like after withdrawing your application. Okay, so same thing. If I don't match into ortho at all, now I don't balance between leaving my family and doing what I love, but I have to balance between being with my family, but doing something that may not be the most ideal thing for me. So this is something that you also have to think about. No one can tell you what to do. I know a lot of people who went into their second specialty and subhanallah, they're happy. And there are other people who decided not to, and they decided to withdraw their application and reapply the next year. And again, ultimately, it really depends on you. There are people who are more lenient when it comes to what they want to do in life. And then there are people who are more stubborn. Personally, for me, if I had to go through that experience, I personally wouldn't want to do anything else other than ortho. But then there are people like colleagues of mine who were like, if I didn't get matched into ortho, it really doesn't matter. As long as I have a secure job or like secure training for the next 4 or 5 years, I'm okay. And so it really depends. At the end of the day, it's really up to you personally. And دائما in these things, you try your best to analyze things. Just write a sheet of paper and just write everything out and try to analyze things. And then استخيروا. At the end of the day, whatever you go through, whether you decide to go through it or not, with الاستخارة, you're going to feel more comfortable with that decision. And at the end of the day, whether you don't match or this or that, at the end, something that's really important to address is ما في شيء اسمه كلنا لازم نمشي بنفس الطريق. So there are people who are going to match من أول سنة. There are people who are not going to match من أول سنة. There are people who are going to go into a different specialty and then decide إنه يحولوا, and then ما في كتاب يقول لك you have to do this, and by the age of, let's say, 30, you have to have your life figured out. ما في. So this is something that brings comfort, because at a lot of times you see people going through what you perceive is the right path in life, and then خلاص, they got accepted, they don't have to go through all the other stuff we're going to talk about in a few slides. But that's not the ما في شيء يقول لك هذا صح هذا غلط. There are people abroad who do like a full bachelor's degree, and then they decide, wallahi, I don't want to do this, I want to do that, and so they start over. There is no time limit to when you can start over, or when, as long as you do not stop improving yourself, and as long as at the end of the day you're happy with what you are doing. هذا أهم شيء. لا تخلون أحد يحسسكم إنه this is how life should be and this is how you should live your life. لا. everyone has his or her own experience and his or her own share of success and failure in life بشكل عام. And so you دائما ادعوا إنه ربي يختار لكم الشيء الخير وادعوا إنه دائما you don't stop improving yourself. فهذا شيء جدا جدا it's very important to mention. So let's say you decided to withdraw your application and you want to try again next year. You want to try with the matching next year. What can you do from this time to that time that can help improve? So you can apply for service resident positions. You can take attachments in the field of choice. يعني I know people ما حصلوا service and they talked to certain attendings and they created an attachment position for them. Attachment is basically like an internship. تكمل intern for like 6 months and then they can write you a small certificate and sign it, and this can add points to so it's basically like work experience for 6 months in the field of choice. I think that was one of the things that the Saudi Council requires nowadays, and helps add your points في scoring system حقهم. So you can apply for demonstrator or academic positions في جامعات كثير تحتاج معيدين في تخصصات معينة. So you can look and see if that's the specialty you want to apply there, go ahead and apply. Try to work on the international medical exams and to work on acceptance abroad. Try to do international English exams, IELTS, TOEFL. يعني this is a good time for you to have a breather, بس في نفس الوقت يكون في إنتاجية. في فرنسا كل فبراير بيفتحوا applications for residency في فرنسا. apply ما انتوا خسرانين شيء. and أنا ما أعرف صراحة إلى الآن هل Ministry of Health تعطي scholarship ولا بس في وظيفتك وبعثتك حقت Ministry of Education. So this is something you should look into as well. وكمان just one thing to add إنه ممكن you apply for a master's degree. There are certain programs يقدموا على master و I think في دكتورة دانا الطبيب تكلمت عن الموضوع. So that's something that to consider as well. مو معناته إنه I withdrew my application إنه I'm يعني في ناس تزعل مرة وتتضايق وفي ناس بيحسوها إنه يعني بيحسسوا الشخص هذا إنه it's the end of the world. It's not. It's not as long as you're improving yourself and يعني هترجعوا السنة اللي بعدها you're going to be a stronger candidate than anyone else because you had whether it's educational advantage ولا exposure advantage ولا يعني أحيانا يقولوا والله إحنا نحب ناخذ السيرفيس لأنه خاص يشتغل يعرف طريقة الشغل يعرف so they're not going to have that hard of a time adapting to the work environment ولا the workload. فدائما شيء يعني يحسن من your application ما هو خسارة وشيء مو يحسن بس من your application يحسن من نفسكم. Develop hobbies, develop a schedule. يعني هذه it's a chance for you to improve yourself and يعني the options are a lot. فيعني إن شاء الله you will find something that you can do. And just last but not least, how do you know if ortho is right for you? زي ما قلت لكم try it, and when you try it try to take the whole experience. تعالوا في نفس الوقت اللي يجوا فيه residents شوفوا كل patients, read, ask questions, attend ORs even if you're not scrubbing in. Just that standing for 4 or 5 hours in a lead gown, that's going to give you enough of a picture of what you might witness the next coming years. Try to study, try to read, and see is it in the books, is it as interesting as it is in practice? Wala do I only enjoy practice? And then look at things that you would rather do other than orthopedics. يعني let's say مثلا أنا personally, even before the matching, I was considering يعني I was looking at okay, let's think about this objectively. مثلا I like working with children, I really liked peds. فلما قدمت في الinternship أخذت peds في KSUMSC وأخذت في الحرس. And I thought, you know, I want to get the full experience of a pediatric resident. And so that's what I did. يعني I would come every morning, I would see all the patients, I would يعني أجي أول واحدة وأمشي آخر واحدة وأقرأ topics وأسأل وحتى في الحرس يعني I did a morning meeting presentation because you have to give yourself that full experience. Is that right for you ولا لا? and then just make a table and كل specialties مثلا of choice, and look at working hours, look at how much you like that thing, that يعني specialty. كيف physical demand, emotional demand, mental demand. if إذا أنتم يعني من الناس اللي من أهم الأشياء عندهم مثلا let's say income ولا the concept of quote unquote social life. فهذه الأشياء كلها put them in a table and try to score all the specialties that you have. And then the highest score is probably going to be the thing that you want the most. At least لو تطلعي ب2 top specialties مرة كويس, because that's what you're going to be able to focus on خلال مثلا your internship ولا خلال like the next few months. This is really important. 2 استخيري بينهم و that's it. يعني أنا كنت محتارة بين different specialties. لما جاء وقت الماتشنج حطيت ortho for like the first 7 choices وأنا مغمضة. I didn't even think. Because يعني at some point الواحد يسعى ويعمل ويسوي ويفعل, بس لما الواحد خلاص يوكل نفسه وكل شيء لرب العالمين خلاص. I tried ortho, I tried peds, and I tried to compare my experience in both. وين وجدت نفسي وين وجدت سعادتي. أنا بالنسبة لي that was the most important factor. To me, orthopedics, I had a lot more fun. I felt like I was more productive. I felt that I could give more. And so I thought, you know what? Let's do it. And دائما ask those around you and ask different levels. Ask مثلا a PGY1 ولا PGY2. Ask a senior, PGY4, PGY5. Ask مثلا a consultant that you trust and a consultant that knows you. And that's really important, to ask people that you trust their opinion. Once you ask, you're going to get a good feel about what your life is going to be in the next 4 years, بعدين after مثلا 5 years or 10 years. And it just gives you a good impression on what you're going to have or what you're going to go through in your life for the next couple of years. I think that's probably it. I feel like, I went 7 minutes over time. But if you have any further questions, please ask them now. إذا حسيتوا إنه you have any questions later on, my Twitter, my email are always available. And yeah, so we'll be receiving questions, if any.
Thank you so much, Dr. Rheema. I have actually a few questions. So
Sure.
The first one was on research. So how would someone go about doing a research in his internship year?
Okay, so let's say يعني it depends on which university you're in, but once you're an intern or when you're an intern, you're still considered under the university. So you would go about as you would with any other research. يعني نفس ال IRB process, that's what I mean. That comes مثلا يعني تبع your university. Or مثلا if you're doing it in another hospital, you would just write the IRB and then مثلا do it with a consultant and a resident from that hospital, and they would submit it to their own committee. But دائما it's nice to يعني the more research you read, the more ideas that are going to come to mind. لما تروح على conferences حتشوف كذا ideas of posters and you're going to think, oh والله ليش هنا they didn't do this, and why did they do that in this type of research. Something that I would suggest, يعني even during your internship, if the research is ongoing and not published, بالعكس, it's a good thing. It's never a bad thing to have research, whether it's finished or unfinished. But usually when it comes to ideas, you can either ask the consultant himself or herself if they have a certain idea in mind, or a research that مثلا stopped at some point. And so they want to continue that. So you can always ask and you can take up the project and they'll add you as a co-author. And in that way, you wouldn't have to start from scratch. Or you can start from scratch. So look at general things. Yani sometimes taking the simplest thing can give you a research. And you don't have to go in depth through prospective or clinical trials. Sometimes doing something simple, first of all, it's going to give you an opportunity to be more consistent with working with it, and it's going to be more easier to understand until you get really, really good when it comes to research. فأنا personally what I tried to do was I tried to do one case report. I tried to do يعني during my years of medical school I tried to expose myself to different research types, and that really helps you in terms of analysis, in terms of writing the research. It's going to benefit you in the long term. فمن الأشياء اللي سهلة that you can do is a questionnaire. Questionnaires, يعني you can either مثلا take a universal scale and you can translate that if it's not already done in Arabic, but something that is commonly used. أغلبها they've already been translated. بس مثلا you can take just a general questionnaire and create it out of nothing وبعدين تعملوا له validation. Or you can مثلا take several questionnaires and you would ask طبعا the people who wrote these questionnaires and combine them into one, into something that helps adapt to the community مثلا or to interns. You can look at مثلا orthopedic teaching methods. الشغلات هذه كلها في الأخير تخدم the specialty that you are aiming for, and in this case مثلا ortho. ممكن تسألوا إذا عندهم case reports. A case report is very easy to write, and مشكلته إنه في الpublication إنه it's going to be a lengthy journey to publication because it's not something that's major. it's just a case report. It's one of the lowest levels of evidence, بس في نفس الوقت it's still a research. So if you feel like you're in short of time ومرة ما تقدروا, definitely do research. For those اللي مثلا who didn't get accepted into ortho ولا سحبوا they withdrew their application, definitely research من الشغلات اللي حتساعدكم كثير. في a lot of residents, especially الآن مع الأنظمة حقت الهيئة, where residents want to do research projects ولازم يخلصوها and they publish it before they finish R4. دائما ينبسطوا لما في أحد they're willing to help them out. فأنت بتدخل اسمك معاهم وحتشتغل في الريسيرش وممكن you don't publish it by the end of internship, بس you start residency and you publish, فأنت وهو كلكم حيصير عندكم خلاص you published, but you don't have to worry about that later on. It's different things or different topics. أنا personally مثلا I try to look at several topics that مثلا I like, مثلا في sports, and مثلا أقول okay في السبورتس أنا أحب كذا وكذا وكذا, وفي upper extremity أنا أحب this topic and this topic and this topic. So I'm going to think about doing a research in one of these areas and try to develop ideas by looking at other research projects. And you're going to see any research that you're going to recreate مثلا من برا, you want to add something. You don't just copy the same thing. لا, you have to add something. فمثلا I take that same type of questionnaire study ومثلا أضيف معها interview. But it's things like this. It doesn't always have to be like hardcore clinical trial. especially as interns يكون عندكم access للpatient data والشغلات هذه. If you have the IRB approval, سهل مرة إنك تجيب حاجة you associate two things مع بعض. Or you want to do مثلا a prospective study that associated this and this. Things like that تساعدكم كثير. you have as an intern you have a good exposure to patient data, a good exposure to, بس أهم شيء يكون معكم IRB approval. You have to have an approval from the hospital to use patient data that's available on the PACS, البيشنت سيستم. احنا عندنا في الجامعي عندنا الإي صحي, and in different hospitals it's different systems. So you have to have that IRB approval just to be safe and to be ethical. دائما شيء مهم إنه الواحد في الريسيرش لازم يكون ethical. But it's not at all difficult. There are many residents who are interested in doing research. I don't think you're going to have a lot of trouble if you show interest in that.
Thank you. And في سؤال ثاني, is it true that orthopedic physicians with the Saudi board never become a full consultant in some hospitals?
Not that I'm aware of صراحة. ممكن as a general orthopedic surgeon it might be possible, but usually when you have a fellowship I don't think you don't become a full consultant in several hospitals, لأنه الآن قاعدين يفتحوا fellowship programs in a lot of hospitals. في الجامعي عندنا فتحوا trauma, وإحنا already في arthroplasty وفي sports وفي في different fellowship programs. So I think they're encouraging residents and they start up in local fellowships عشان to be able to become full consultants.
Okay, and one last question. You mentioned that there were 36 applicants to the orthopedics program, and 32 were accepted. Does that
Yes.
mean only 36 people applied for orthopedics, or only 36 people wanted?
No. So basically, they're around 36, around 32. That's like best of my memory, صراحة. But usually it's around that number. So around 35. So basically, everyone applies to the matching system, and there's a certain cutoff. يعني مثلا, let's say السنة هذه المقاعد في الأورثو are 35. So let's say a lot of people apply. So the top 35 with the top scores are the ones who are going to be nominated for orthopedics. And that's why I kept stressing on the fact that no, you have to try your best to do well when it comes to SMLE, when it comes to GPA, and when it comes to CV points اللي من الهيئة. Because these are the things that really factor in your total score. يعني في الأخير they add these together in certain percentages. وبعدين they give you that final score. And so the top people who apply for orthopedics اللي عندهم the highest scores هم اللي يدخلوا matching process. So they get nominated for orthopedics في المدينة المعينة. And وطبعا الرقم يختلف حسب المدينة وحسب كم يعني حسب كم مقعد عندهم في كل city. let's say مثلا let's say this year كانت المقاعد 30. كلهم 30 دخلوا matching process, and these were the top 30 that applied. الباقيين أنت تحط choice from 1 to 10. You put 10 choices of things that you want to match in. الspecialty مع الarea. فبعدها خلاص with this algorithm إنه the top people يروحوا first choice. let's say مثلا أنا I wasn't the top 30. I was مثلا the 31st applicant. يودوني رغبتي الثانية, which was let's say مثلا ortho في جدة مثلا. So this is how the matching process works. فأنا مثلا my score was very high في جدة, but my score was relatively low مثلا في الرياض. There were people who were better than me في الرياض وزي كذا. And this is all when it comes to numbers. This does not take into consideration your electives or your performance في your electives. electives والشغلات هذه تدخل متى؟ لما خلاص all the people who were nominated, the 30 اللي were nominated في الرياض, هذولا يدخلوا الانترفيوز. Let's say المقاعد السنة هذه كانت 26. So 26 يدخلوا, 26 will get picked to centers, ومثلا 1 أو 2 ما حيحصلوا. they will go through matching process again. أو مثلا أحد انقبل في center وسحب his application مثلا, فيصير هو يدخل مكانه اللي بعده. This is sort of how the matching process works. يعني في certain areas where you can get nominated بس في الأخير ما تدخل في center. Ortho is one of the specialties اللي I think يعني يمكن بس 1 or 2 اللي ما في الأخير ما يدخلوا center. الباقيين كلهم يعني ما شاء الله they get matched. That's a really good percentage.
Thank you so much. That for very يعني full and conclusive lecture.
الله يعطيكم العافية. I wish you all the best. If you need anything يعني feel free to ask. And إن شاء الله نقابلكم as our colleagues قريبا.
إن شاء الله.
الله يحفظ لكم.